DES has had a devastating effect on my life and that of my husband and my whole family.
This has affected me all my life. I've lost babies.
The women and their children left to bear the costs of DES, the drug prescribed on the NHS that's destroyed lives.
I had a very rare form of cervical cancer and had a hysterectomy when I was 9 years old.
I've had a lifetime of treatment for infertility and many times thought I would never have a child.
Almost 500 people have contacted ITV News after our year-long DES investigation, the wonder drug that became a medical disaster.
Every day I live with the risk of more disease, but I want people to know the truth and to make sure DES is never forgotten.
He said if I took this drug, it would help me keep the baby.
Mary was prescribed DES tablets by doctors in Newcastle for 6 months after suffering multiple miscarriages. Daughter Helen was born the following year in 1967. It wasn't until she was a teenager that doctors realised the drug's serious side effects.
That's when I was about 14. I remember lying on the floor in here in pain.
I wanted you to have a family, but it just wasn't to be. You couldn't go on suffering the way you were.
In her 20s, she was diagnosed with a misshapen womb and later cervical cancer.
The pain just got so bad that we agreed that the best thing to do would be to have a hysterectomy, take away all of that sort of danger, if you like, and risk and pain. But I'm still in pain now, 20 plus years later. And it's the worry of what else could go wrong.
And what's it like for you today, hearing what Helen's been through?
She really suffered, and I was devastated at the time because you want your daughters to have a family like yourself, and I've always felt, you know, that I caused it, but I was advised to take it, and I took the advice, and I've regretted it ever since, but I can't turn the clock back.
DES is a synthetic estrogen. It was prescribed to thousands of pregnant women between the 1940s and 1980s. It was meant to prevent miscarriage, but instead left behind a devastating trail of rare cancers, infertility, and lifelong complications for the children of those who took it. Hey! Now their calls for justice have reached Westminster. Hundreds of people have set up a campaign group following our reporting, and MPs are supporting their cause.
I genuinely think this will be considered the biggest British pharmaceutical scandal there is.
And the lawyer representing victims wants a full public inquiry.
I think the government are to blame here. This has been a regulatory failure at the highest level. This was a drug that was allowed to be manufactured at will, and this was a drug that was never regulated. Nobody ever looked at the harm.
Stilbestrol.
And one MP who advocates for women harmed by medical scandals says GPs must listen to women's concerns.
The GPs, the doctors, know nothing about this. I haven't heard of it. They're literally Googling ITV coverage to, say, well, what is this? And I've heard that so many times.
I'm in pain every single day, so it's not something that ever goes away or that I can ever forget about.
Jenny's returning from her latest hospital visit. DES exposure has had life-changing consequences. At 23, she was diagnosed with clear cell adenocarcinoma, the rare type of cancer linked to DES. Radical surgery followed.
So he said I was going to have the vagina removed and rebuilt. I was to have a hysterectomy done, and he said it once all the scans had come back, he said that the cancer had spread into the bowel.
Treatment that left her infertile and with a stoma bag for nearly 4 decades. Her mother's medical records prove she was poisoned in the womb by DES.
What does this document show?
This is my mum's antenatal record. It shows on the 14th of January 1965 that she was given DES.
Jenny later tried to sue the drug companies responsible, but couldn't afford a long court battle.
I'm angry in a way that it's just been brushed under the carpet, really. And people have just been left to get on with it, and a lot of women have suffered.
Today, there are still no cancer screening guidelines in the UK for DES-exposed daughters, something this gynaecologist says must change.
For the women who were DES exposed, they present with an additional risk of a rare type of cancer that requires more frequent screening and also with additional tests to be able to pick up this rare type of cancer.
And for those who've lived with the devastating legacy of this drug, they now just want the truth about what went so badly wrong.
Sarah, what has the government said in reaction to your reports?
Well, we've put these points directly to the Health Secretary, Wes Streeting, and he says he's looking seriously at these allegations and ultimately what redress and remedy in this case could look like. He also said that his department is looking at how it could better support the many families who have been affected by this drug. And as a result of our investigation, he has now asked NHS England, as a matter of urgency, to work closely with local cancer services with the view of making sure that doctors and GPs know about DES, they know about its impact, and as a result, women get the right treatment. Now, this has been seen by those affected as a significant step forward today, but there is still much more to do because let's remember, this was a huge regulatory failure. The cancer link was known in the 1970s, yet this drug was still given to women in the 1980s. And those I've spoken to today feel that they were failed all those decades ago. They continue to be failed today because there's been no attempt to trace and inform those exposed to this. And they now want accountability for those failures.
Let's see if they do get that accountability. OK, Sarah, thank you.